That having multiple sexual partners, use of injection drugs, alcohol, other substances that can impair decision-making ability, use of PrEP, which may lead to decreased use of condom, hence increased risk. Inconsistent and irregular use of condom during sex, vaginal practices, so those are some of the risk factors which you find that can expose somebody to the STIs infection. Now we'll go to the diagnosis. How do we know that we are having the infection? Because most of them are asymptomatic, but we might be infected and we are not aware. So diagnosis of STIs, many a time we encourage the youth to talk to health provider about risk of STIs for testing, advice since STD do not show symptoms, most of them. So we advise them to talk to the healthcare provider so that at least can advise them. We have it can also be diagnosed during physical examination in the health facility. When somebody is sick, he goes for treatment. Then of course, when the doctor does the full examination, he will find out that this person is suffering from this condition and can also be treated in that manner. We also find that there is diagnosis, we can do it through microscopically. We'll take a specimen from we can take a specimen, get also from the source or fluid swab from the vaginal penis or anus. Then we'll test and also will show us which kind of bacteria that the person is suffering from. We can also test the blood and find some condition in the blood. So there is how we classify the symptoms. STIs or STDs syndrome, namely penile discharge. We classify as urethritis. Vaginal discharge, vaginitis or cervicitis. Lower abdominal pain in the women, pelvic inflammatory disease. Sores of the male and female genitalia, called genital ulcer syndrome. Abnormal growth on the genitalia or the neighboring areas in both men and women, genital warts. Neonatal conjunctivitis, when a child is born with the problem in the eye, so probably when the mother had an infection of STDs, then the child can be born with the infection, which is called ophthalmia neonarum. Abnormal swelling of the lymph nodes in the groin, pubis, anorectal discharge. You can have anorectal ulcers and scrotal swelling or pharyngeal infection. So those are some of the presentation how the STI can present and how they are called. Then we'll go to the prevention. When we go to the prevention of the STIs, we can do vaccination, like for the HPV, we do the vaccination so that they are not exposed to the infection. Reducing the partners which you are indulging in sex with, correct use of condom, regular checkup of your health condition. So primary prevention, we have interventions like abstinence, condom promotion to increase their use, and reduce barrier to utilization. Behavioral change, we need to change our behavior, behavioral change intervention with explicit messages about the risk of STIs. The PV, as I've said earlier, the HPV vaccine, bivalent, quadrivalent, or 9-valent, that is the type of HPV which we are using. Hepatitis B vaccination for those who are not vaccinated when young, they can still be vaccinated with HPV, with hepatitis B. Then outreaches and peer-based intervention for high-risk population, on-site individual counseling and HIV testing, mass communication regarding risk reduction and multiple component motivation. So when we go to the treatment, we go to when we classify the diseases, we classify them based on the cause. So we'll manage them with the symptoms and signs presentation, which will lead us to make a right choice of management. So most of the diseases we'll just manage with the antibiotics. We give them bacterial drugs based on the cause, but we find that there is no cure for the STIs or STDs caused by virus, but we can only use some medications to reduce the severity. So with those few remarks, I beg to end there, unless there is a question which we can handle. Thank you.
Thank you so much, Dr. Obiero. That was insightful. We really appreciate it. Just go to the first slide.
Yes.
Yeah. No. The second, yes. So like I said, this is going to be an engaging discussion from all of us, just to get to know how best we can work together in so many ways to help mobilize youths and also help engage those who are in sports, those who are in schools, those who are running different initiatives that are working with young people. Because at the end of the day, they need to share this information. And at the end of the day, we will have to build a sustainable, healthy community for youth. How can we achieve this? We can achieve this when we try as much as possible to realign some of the work that we do in the community with the World Health Organization or any other stakeholder which is doing the same. So what the biggest question that we will ask each one of us, what concrete action or intervention needed to achieve these goals? I will start with it's a question, maybe if you are ready, but all of us should contribute. I'll start with Mr. I don't know if you are ready, you can raise your hand, just even a concern, or you can contribute towards that. You help us understand, like, how can we work together? You are in the medic area, you are a clinician, and we have people, community work officer at the grassroots level there. We have different people working with the youth. For example, if we do sports, and you find most of the time people just concentrate on sports without leveraging some of the sports activities that they are doing with some of the work that you are doing within the facility. How can we work together? How can we collaborate to ensure that there are no vaccine going at a waste within the facility, ensuring that young people have come out so strongly without stigma so that they can seek help within the facility. And what are these stigma incidences that are really barring young people from coming for those services within the facility? I don't know if somebody is ready. Maybe I'll just give Kaumba Kevin some time to give maybe some insights. I'm a little bit concerned in regards to the question that we are going to discuss now, so that we give it all our best. At the end of the day, we see on how we can collaborate to help young people be healthy within the community. Kaumba, over to you if you can hear me.
Oh yes, I can hear you. Can you hear me?
Loud and clear.
Yes, sorry. I'll put my video up shortly. In a place where we have very fluctuating net, and now it is fairly raining.
Don't worry about the video. You can remain over. Yeah.
Yeah, you said about, okay, thank you for the presentation, Daktari, and also thank you for the rejoinder you've made, Collins. And so you've asked a very pertinent question, especially with the respect to the youth. What can they do to issues related to the same, the STIs, the health and related issues? I don't want to claim expertise, but I may share just my idea and my perspective and maybe something I've interacted with in the course of my duties and so and so. Now, maybe some of the things, maybe some of the issues related to the stigma that the youth are facing. One is because the environment or the health facilities are not youth friendly. One way or the other, you may go to such facilities and those people you find they are fairly aged people. So first, as a youth, when you have issues like these or challenges related to the same, you may not feel comfortable going and sharing with such kind of people. Not being youth friendly, I've just said one, maybe the people manning such facilities may not be youth themselves, but also the way the facility has been crafted or put up, it may not be so much in line with maybe the whatever youth is expecting when he or she goes to such a facility. The language used there, the kind of resources maybe you'll find there. So these are things that maybe a youth may shun easily, even though it's a facility that might be of help to the person if you have such kind of challenges. So I would really advocate for the stakeholders, either public, private, we come up with facilities, centers that are youth-centered, but youth-friendly at the same time, so that when I have an issue, I can go there easily and I can easily identify with the place without any form of victimization or without feeling being stigmatized in one way or the other. But also apart from that, there has been a bit of laxity in matters related to health education and services. So I would really also advocate for such services, such talks, education. They should also be youth-led. You know, when you go, I've attended a lot of activities related to the same. You find the people giving talks, the people facilitators giving these seminars and workshops are not necessarily youths. So in a way, you may not easily identify with these, but also you will not take stage center responsibility and feel it as part of you as a mitigating factor or measure. So I think also we need to sensitize our youth to take up leading role in youth health education and services. And also, apart from that, We also need to advocate for frequent, maybe, so to say, things to do with screening and related, and like the doctor pointed out clearly, to do with the vaccination of HPV. It's very important. But by and large, our major concern should be how can we be able to make these services, these facilities, these forums be reachable to the majority of youth. The bottom line here is the challenges that youth face. This is what will make the youth maybe not go to that. They will feel victimized. They'll have that kind of unyanyapa, in the society because of the challenges they face in the first place. And this borders self-esteem, and self-esteem comes with so many issues related to it. For example, job. Yeah, you don't have a job. It comes with challenges related to the same. You don't have the right, maybe education, the language expression, your position in the society. So it comes with so many things that may in turn affect you as a person to even seek the relevant, necessary services that you should be seeking when you have such kind of challenges. So working on the self-esteem of our youth, and especially the challenges that come with the same, bordering unemployment and education, level of education, literacy levels of technology used and stuff like that. So I think these are issues that need to be looked at, that should not be actually should not be shunned or should not be looked down upon, but because by and large they contribute to the well-being of the person, and will make somebody go seek services or not to go, and it in event it will only accelerate the problem. It will not make the problem, it will not solve the problem, that is to say. So there's a lot the youth can do, and I believe we cannot do everything as youth alone. We need a lot of partnerships, both private, public. We need a lot of youth education, advocacy programs that will bring youth closer by and give them the right incentives that will make them attend such forums. And also, maybe just a parting shot before I leave. I may not be exhaustive, so to say. By and large, we lack awareness. So awareness is very key in everything. Awareness is very key in everything we do. So many people might be techno-savvy, but whatever we know may be this much limited, especially regarding the youth. And so let us work. We could work on this to assist in mitigating such issues. But the youth should take center stage, should take leading role. And so I think that is for now, that's what I can be able to share. Thank you.
Thank you so much, Kevin. That was an insightful. I really appreciate that. It is about partnership. So I'll not waste a lot of time. Maybe I can choose randomly. I will ask Dorothy, Uma, maybe to say hello, tell us a little bit your name, and maybe a concern or contribution towards joining hands to achieve some of the targets that the World WHO has put in place. Karibu sana, Dorothy, if you can hear me. You are on mute. Okay, so Linda, can you hear me now? Do you have a moment? Can you give maybe some verdict of the discussion and how you think we can work together to reduce some of the STIs cases that we have in the country? Okay. Christine, are you there?
Yes, I'm here.
Okay, please, karibu.
First of all, I may say that this discussion is very important because from where I sit as a clinician working with the key population, and most of them are youth. And as we are talking also about STIs, it means that when you see an STI presenting to probably the youth that you're managing, we know that it can lead, it is one of the things that leads, it makes them to be susceptible to getting an HIV infection. So for prevention and control of STIs, some of the strategies that come into play, or what I can think about, as my colleague has mentioned some of them, I would say education and counseling of persons at risk on ways to avoid STI through changes in sexual behaviors, and also the use of the recommended prevention services. It is also important for us to evaluate, treat, and offer counseling to the sexual partners of the people that are infected with the STI, because when you look at STIs, we always talk about the 4 Cs, and we also need to know the risk factors that are actually making our youths to acquire STI. For example, when we are looking at primary prevention, because in STI we have to look at primary prevention and also secondary prevention. In primary preventions, we are looking at issues of abstinence. We are looking at condom promotion to increase their use and also reduce barriers to utilization. We're also looking at issues around behavior change interventions with explicit messages about risk of STIs, and probably on-site individual counseling, and also HIV testing, mass communication on regards to risk reduction, and also multiple components of motivation, because you can use advertising campaigns and also skill education on the STI clinics. So for me, from where I sit, I would also want to do identification of asymptomatically infected persons, and also the symptomatic persons, and like to seek diagnosis and also treatment, because some of the times the youth come to the facility with probably just a pinpoint problem, but us as a healthcare workers, when we do STI screening, we find that, okay, asymptomatically they don't present with the symptoms, but once you offer the screening to them, you find out that there are issues around the STI that needs to be managed. Then effective diagnosis, treatment, and also counseling of the infected persons come into play. And I will also want to echo the pre-exposure vaccination of persons at risk for vaccine preventable STIs that we normally have. So for secondary prevention, we are talking about discouraging risky sexual activities and also encouraging partner notification infections, because these people are sleeping with one another. So we should actually encourage treatment of also their sexual partners, not only them. And looking at STI, we remember that symptomatically it is very easy to treat these clients, because at times when you want to go the etiological, the clients probably will lack money for the laboratory examinations that we have given them, but the best approach would be the symptomatic approach. And I believe the NASCOP has done a great job just offering us the symptomatic treatment of STIs. Thank you, and back to you.
Thank you so much. Wow, that was so great. Thank you for bringing that secondary and primary aspect. I really appreciate it. Okay, so I don't know if there is a new person who has come in. Julius, maybe you can say hello to the team, and maybe you can give, we are almost winding up. If you can hear us, you can give your take about the STI situation, and how you truly believe that how you truly believe in partnership to have the situation that we have around STI, to reduce some of the cases that we have in our community today. Over to you, Julia. Can you hear me? If you can say hello, you just join. Maybe you're trying to digest. Okay, okay. All right. I've seen the question from Linda. So this one I'm going to give to Dr. Joseph Obiero. How can we help one overcome stigma as a challenge faced by person affected by STI? And maybe you can your video is a little bit tilted. Maybe you can put it. Yes, that's better. Thank you.
Okay, how we can, the question is how we can help somebody to overcome the stigma.
Yes, yes.
Yes. The stigma we can overcome through health education. When we, us as healthcare workers, we need to do health education. As it was, as been said earlier, that when we have these facilities, we need to have youth-friendly. When they have youth-friendly, and you see peer-to-peer education is very important. So we can have youth-friendly, whereby I can tell them, talk to them through health education, and by doing that, they will overcome the stigma because they will take it normal. You know, it is just a normal thing because so and so is also suffering from the same, so and so is suffering from the same. So they will become open with their problems so that they can discuss it freely, so that they can be managed. Then this one, I think, brings us to barriers because we have some barriers. So when we can overcome cultural barriers, we have cultural barriers because every group, every tribe, every community, they have their own cultures, what they are supposed to talk about and what they're not supposed to talk about. So for a Luo, there's something which they can discuss. But for some tribe, they can't talk about that. This is a taboo. So when we overcome this culture and religion things, then I think that one also can work on can help us to reduce the stigma. Age. Yes. Then access to the STIs information, I think it's the same thing with the health education. And yeah, I think with those, I just turn it over to you so that somebody can add. But with the culture and religion, with health education, then we can do it. Thank you.
Okay, thank you so much, Joseph, for such a response. Really, always with STI, there is always a fear for unknown. That's people fear that, okay, what will people say about me? Normally, if we have those youth-friendly facilities, I think, and also do some awareness and training or education to the youth, they'll be able now to be enlightened and know the importance of having that done, or even seeking, going to the facility itching or abnormality. So I'll go to Robinson. I can see your hand. Maybe if you have something to say, then I'll move forward to the next person.
Okay, thank you, Collins, and thank you, Joseph. Thank you, Christine, again for that very insightful contribution. And I have just a little concern, particularly I'll address this to both Christine and Joseph. My interaction with some of the youth in the village is that however we say we do awareness, but we find that the level of awareness among the youth is still low. It could be attributed to what Joseph has said because of the cultural differences. But then I would direct this to provision of prevention, uh, uh, let me say, resources to prevent that can be used by youth to prevent the spread of STIs. And in particular, I'll relate this when I was growing up, when I was still in that teen area as adolescents, my dad used to work with some of these NGOs, and I remember he would occasionally come with packets of condoms and put them in the house. I didn't know why, but at some point now when I was growing, I now realize the reason why he used to do this. But my question and my concern is, if you go among the youth and looking at the village setup, access to some of uh, these these accessories is very difficult, especially among the youth, because walking into the health centers to pick these accessories sometimes is very challenging. And looking at the stereotyping and the stigma in it, how do you think this can be addressed? Because the reality is that the youth are engaging in these affairs, in sexual affairs, but then we need to find how can we help them. And helping them, one of the key areas in preventing this is providing accessories, of which you find that they are not easily accessible to the youth. What do you think from your experience working with different setups? What do you think need to be done in such particular scenario?
Maybe if, Joseph, you can come in, and then Christine, if Christine is there, you can also give your thoughts.
Okay. Just come up again with the question. Just repeat the question a bit, Mr. Robinson.
Yes, I'm saying, Joseph, that looking at in terms of preventing the spread of STIs, one of the key aspects is providing accessories. And in I talk of accessories, there's stuff like condoms for youth, because we agree that the young population are engaging in sexual intercourse. But then you realize some of them are not accessible to some of these condoms that they can use to prevent the STIs. And looking at it in particular in terms of stereotyping, because most of these accessories are found in health centers, and just a youth walking into the health center and picking that, sometimes it's more of a big challenge, especially in a village setup or a rural setup.
Okay. Just to respond to that, of course, it's a very big challenge to handle that with the youths, because they fear of partner notification. They fear that maybe when I go and get this thing, this person is going to tell somebody I'm doing this, I'm doing that. So I think how we can combat that, there was a time earlier on, sometime there was some NGOs which were putting this condom at a particular place, so anybody can access them. And that thing is still going on even in the hospital facilities. We have an area where you can just go and pick some condom at your own pace and at your own time. So when they are informed, they have the information, they don't have to ask somebody. You just go to the facility and you go to the booth there, you pick your condom, then you go away. So, and also with the initiative, we can also advise through organization to organization that we partner with this health facility, that they ensure that there is no point when the condom is not in that booth, unless there is condom stock out. So to give this youth easy time, but not only youth, even adults are going and picking them there. A facility where I used to work before, the condom was ever there. Any other time, just come when people are there, when people are not there, you pick your condom, you go without asking anybody. So I think that also can reduce the infection because they will be exposed, they will be able to get the condom at their time without, because going to buying the condom in the shop also is a challenging. You don't know how you want to tell them, give me condom. They fear. So they will just decide to go and have unprotected sex simply because they are prepared for it, but not knowing that they are exposing themselves. So I think that one also we can look into as an organization which are dealing with this. Thank you.
Okay, thank you so much, for that. Christine, what's your take about this?
Thank you very much. For me, I would say that working with the key population has really like opened up our thinking and the way we do things. It's not business as usual. We can do everything and give messaging and all that, but then it all depends on the individual person who decides to like access the commodity and use the commodity in the right way, because I can pick a condom and I don't use it in the right way, and in the long run, I end up getting an STI. So messaging around correct, consistent condom use should come out strongly. And dispensers have really played a very key thing, because you find that in most of the hotspots, condom dispensers have been put, and they are like checked like once in a week to see that they don't lack condoms at any given point in time, not unless we have stock out of condoms in the country or in the county. Then we also do like peer-to-peer, because we have peer educators who like make sure that they are manding their cohorts and they are distributing condoms as one of the key mandatory activity for the program. So at no single time do these youths actually lack a condom. And even if they lack a condom, they know from where to pick, which points are there that they can actually access and pick these condoms. Really insisting on the correct and messaging around condoms, because if we give them correct messaging and we tell them they have to use the condom consistently so that they can protect themselves either from getting the STI and from getting the HIV infection, the messaging would really go a long way for them to actually understand why is it that I'm being told I have to use this condom. So correct and consistent messaging and the correct and consistent use of the condom should actually come as number one when you're thinking about prevention of STIs and HIV infection. Thank you, and back to you.
Wow. We've taken note about that. Well, that's very powerful. Mr. Kaumba, you have something? A question or a concern, please? Go ahead.
Yes, can you hear me?
Loud and clear.
Okay, thank you very much. I want to appreciate the input of the experts we have. Just to share some experiences I've had with the youth. One is that it is a big challenge when you give these contraceptives, especially the condom, during the daylight. During the day, it's a big challenge. You may find almost everybody wants, but during the day, it will bring about what we talked about, stigmatization. And so it's a big challenge being given during the day. And where is it being given? Those are some of the challenges that comes with it. And also when you are seen to be having or being given or taking condoms or any other contraceptive, it's equated to being promiscuous. So those are some of the challenges that come with this. But now my take about this, how do we enhance that? They have said that we have areas where we have condom dispensers, but mostly you find they're only in the dispensaries and health centers. And always it's good and important that we could extend this to other public places that are outside the hospital areas, because there are even people who fear going to the hospital itself. Some of the youth was engaging, they even fear going there. So it would be very prudent if we expand the scope where these dispensers are put, market areas, and any other public places which are monitored from time to time. But also working with other youth organization and youth leaders is very important. A youth may be afraid or may not want to take a condom, but in event they want it. If you give it to the youth, different their leaders, it's very easy for them to give them when they have their own meetings, when they are doing their own, they are more comfortable when they are with their friends and doing that. So that is also an area that we have explored sometimes in the past. So another area that we seem to be missing, because most of the time the information that we may have about contraceptives and the issues of STIs and stuff like that may come from the senior people within our families and environment. And so our parents are very important in this. They should never be left behind, because they also at times they hold very conservative ideas about contraceptives and maybe condom and stuff like that. So they would come in handy. We don't need to leave them behind. We need also that education, the sensitization should also include them, so that when this thing comes from a parent, it's easily absorbed by the youth. The youth will easily embrace it. And also one thing I would also love to highlight is that sometimes we have always used opinion leaders in things like this, and they have worked sometime back, like the politicians and these in influential people. By and large, if you look at the condoms provided by the government, they are really not enough. If you go to the dispensers, you may go in the morning, or during the day it's full. When you come back the following morning, it has been consumed the whole night, it's not there. So there's a lot of partnership that should continue between the private and the public, and especially the NGOs to ensure that we provide this. It's better off provided than not provided at all. Because even when you were back in the university, you realized a lady fears getting pregnant than fears STIs and the related AIDS and stuff like that. She fears pregnancy than any other thing. So STIs was not an issue, HIV is not an issue, but at the end of the day, these are things that bring a lot of challenges in your life. So I think this kind of partnership is still important to date, and we should really encourage it. By and large, the awareness thing will take center stage in whatever we are doing. Thank you.
Thank you so much, Kavins. Unless, do we have anybody with a concern or question? Okay, so it seems we have none. All right. Any concern or question? Okay, great. So I'm going to at least go back to Robinson to give a vote of thanks. Then after which we will work on the report for this discussion and also share it with the team. We've noted all the people who have attended. We have on the list. The attendance today was not good, but we believe next time it's going to be big. And we are going to continue with these discussions, and we are going to continue with action. So it is time for action, but not more of discussion. So we are representing some very large number of young people, and we believe through these discussions, we'll be able to act the right way, to reach the right audience, so that we may bridge the gap that we have within the STI, and so that we help achieve the goals that we have that have been set in STI by World Health Organization. So over to you, Robinson. Are you there? Oh, okay, Kavins, maybe you can give a vote of thanks. Robinson has dropped. Oh, he's coming back. Okay, so now we wanted to share the contact for the person that you can reach in case of anything. Okay, over to you, Kavins. Oh, I think even before winding up, we will want to at least let you know about the upcoming events. We will be hosting a youth event in partnership with Tangaza University College. This is going to be an interactive convention and we expect a minimum of 300 people across Africa, and it is also going to be virtual. So please feel free to register so that you also become part of that discussion to build a healthy, sustainable community for the youth. Over to you, Kavins.
Well, thank you very much. I think I've talked a lot, but it's okay. Thank you for the task you've given me. I'll be very brief. The beginning, I want to thank everybody for attending, all the participants. It's not a wasted time. It's not a wasted opportunity. At least we've gained one thing or the other, and also we've enriched our scope. And now, secondly, I want to thank the Daktari for sharing with us very insightful things about HPV and then related STIs. We want to thank you very much, and we pray that next time when we call you again, you'll be able to find time and share with us more. We don't take it for granted that you are part of us. All the teams, all the people that took part in this, we are most welcome and feel appreciated for being part of this great team. Be the agents of change that the society need, the youth need, and be a shoulder to help a brother, to help a sister lean on whenever they wanted any information that would be beneficial to the youth. By and large, like Collins has said, I wanted also to put the reminder of our upcoming convention in August. It will be 2-day hybrid convention, like he said, with hosted in Tangaza University College, but it will be a Pan-African youth convention. So it will be a very rich a convention, a very rich engagement ceremony that we really.
We lost you. Okay, I think we have lost Kavins. We can't hear him. Like he was saying, this is going to be a Pan-African convention, and we expect people from private and public sectors to attend. We have several confirmation of sponsorship and several confirmations of attendance. So be part of this discussion, and looking forward to partnering with you. And this discussion is not going to end here. We will share a bit of our next discussion on STI, and we will focus now on each most common ones, starting from the HPV now, which is the center talk, whereby young people do not take initiative of coming for the vaccine. And if you, according to the research that we did at some of the questions, you find young people are not even aware of what HPV is all about. And this is something that is really serious. Young people really need to be knowledgeable in this so that they know what HPV is all about. They know what of some of the symptoms for the HPV, and they should know the facilities that they can visit for the vaccination or immunization. So thank you so much for the delegates who have joined. I really appreciate your time, and we'll get back to you as soon as possible. Enjoy the rest of your day. Bye.
Bye, everyone.